Hi, good morning. My name is Jennifer Padron, and I live in Washington, D.C., and I split my time between the D.C. Metro and Atlanta. I am the Associate Director, Principal Investigator, and Project Director for the Washington, D.C. Recovery Network as a part of the Campbell Center's programs funded by SAMHSA. Commissioners, I had been asked kindly by my good friend and colleague Adam Schlossberg, the Managing Director for Beyond Today International, to ask you for your ear and compassionate listening this morning. What I would like to tell you is simply that Austin Travis County Integral Care, led by CEO David Evans, is doing a job that can be compromised easily. I'm urging you to take a look at the practices around the Certified Peer Specialist program, the Peer Services and Supports portfolio of programming that ATCIC offers, and also to consider that peer services and peer supports nationally is integral to healthcare and integrated co-locating behavioral and physical public health care. I am very concerned about the state of peer services and peer supports in general. There's a trend nationwide at this point around re-warehousing under a new quote-unquote modern asylum those who are in deepest and greatest need for community public health, mental health services. I'd like to ask you to support in any way which you can do those people who are living on the streets, people that are in shelter, people that are in crisis, people that are living in despair with no hope any longer, and let them know that you have the services that can help. When I got my CPS in Austin, Texas in 2007 through the Depression and Bipolar Support Alliance and Texas, taught by Appalachia consultant Ike Powell, the curriculum, and Beth Filson, and another gentleman from the Veterans Administration. It changed my life. I became a CPS because at the time I was on Social Security Disability Insurance, SSDI. I was in despair and I had no means of truly supporting myself financially, emotionally, or otherwise. I was in pretty bad shape. And so the CPS that was offered by DBSA Texas and DBSA National was a fabulous opportunity for me to change the course of my life. I'm a person with lived experience. I have a psychiatric diagnosis from 1998 from California, and I'm a psychiatric survivor from invasive clinically medically necessary ECT that was provided to me for 2.5 years in a provider in the city of Austin. I understand. I know. I currently am doing well. That I see a lot of ways that you can provide further help to people who are living with a serious persistent mental illness. And I name it that because that's currently the phrase offered by the medical model. Now, under a recovery-oriented systems of care, ROSC, ATCIC is able to do a lot more, and you're not. I urge you to consider ways that you can do this. Adam Schlossberg and myself, and many other people at the national level and regionally, are working together to come up with models of care utilizing peer services and peer supports on behalf of the people who need it the most, and that's basically us, our community, nationally and regionally. I urge you also to take into consideration the fact that the CPS can be further utilized and best utilized in an integrated care environment. We lower the numbers in the emergency room. We lower the numbers for recurring inpatient psychiatric treatment and substance abuse treatment. There's a lot of different things that we can do, and if you want to see the data, please go to look at Optum Health's external report dated 2000 and I think it's 14. I'm going to go ahead and send a PowerPoint in addition to this video, to Adam to share with you on the ways that the CPS can help solve the problem and the urgent emergency of our public mental health community system. In closing, I'd like to tell you that I appreciate your work, and on behalf of myself and my friends and colleagues at the national level, thank you very much. There's a lot of work to do. We have no time to waste.